to everyone, and you're all welcome to today's discussion in a surgery. Yes, so like I mentioned earlier, today we're going to talk about amputation. Yes, today we're going to talk about amputation. So to start our discussion, we have to start with setting objectives. Yes, we have to start with setting objectives. So meaning that by the end of this discussion, each one of us must know the definition of amputation. That is the first objective. Yes. From there, we have to talk about the classifications of amputation. Yes, we have to know the classifications of amputation. From the classifications, we have to talk about the types. Yes, we have to know the types of amputation. From the types of amputation, we have to talk about the indications. Yes. Then finally, we have to talk about the management, both pre-op and post-operative management. Then we'll end with the complications. So those are the objectives for today's discussion. So I can see there are some people that are live. So please you can share the live video so that our friends could be part of this discussion. Yes. So now let us start with the definition. How do we define amputation? How do we define amputation? Right. So in my definition, I'm saying amputation basically this is just the surgical removal of an individual's body part through a bone. Yes. So that could be due to cancer or maybe due to a trauma. Yes. So one important thing that you have to take note is that when you are defining a surgical procedure, you're not supposed to talk about the characteristics. The only things that you need to talk about are the indications. Yes. So I've clearly mentioned to say amputation, basically this is just the surgical removal of a body part through through a bone. And it could either be as a result of trauma or maybe cancer. Yes. Then from there we can talk about the characteristics. Yes. Rather we can talk about the classifications. Yes. So for the classifications of amputation, what you have to know is for the fact that amputation is classified in two. Yes, there are two classifications of amputation. We have open amputation and we also have closed amputation. These are the two classifications of amputation. Yes. So when we talk about the first classification, which is open amputation, this one it is sometimes known as quilon amputation. Yes, open amputation is sometimes known as quilon amputation. Yes. So basically this one it is a classification, or it is a type of amputation where the surgeon does not close the stump after an operation. So the main purpose why that stump is left open, it is for the purpose of antibiotic administration. Yes, so mainly this is indicated in conditions such as osteomyelitis, where there are some infections of the bone. Yes. Then the other one is closed amputation. So for closed amputation, this one it is sometimes known as flap amputation. Yes, it is sometimes known as flap amputation. So for this one, after an operation has been done, the surgeon usually closes the stump. That is the reason why it is called closed amputation or flap amputation. Yes, the stump is usually closed. So those are the classifications. So if you're asked about the classifications of amputation, remember to say there are two classifications. We have open and closed amputation. Closed amputation, it is sometimes known as flap amputation. Open amputation, it is at time known as what? Quirón amputation. So these are the classifications. Then when we talk about the types, we have quite a number of types. Yes, we have what we call AKA. Yes, that is above knee amputation. We have BKA, that is below knee amputation. And we also have knee disarticulation. Yes, we also have hip disarticulation. All these are types of what? Amputation. Then if it is amputation that has to do with the arm, we have above elbow amputation, we have elbow disarticulation, and we also have what? Below elbow amputation. These are the types of amputation. So please don't mistaken the classifications with what? The types. For the classifications I've mentioned, clear to say we only have two classifications of amputation, which are closed and open amputation. Yes, I hope people are following. So for those that are online, you can please share the live video so that our friends could be part of the discussion. Yes. So from there, you can talk about the indications. Yes. So what are some of the conditions that would need amputation? So there are quite a number of conditions that that brings about what? Amputation. We have cancer. Yes, cancer is one of the indications of amputation. Gas gangrene, it is one of the indications of what? Amputation. In addition to that, we could talk about what? Trauma. Yes, crushing injury is one of the what? The indications of amputation. From crushing injury, we could talk about what? Peripheral vascular conditions. Conditions such as diabetes mellitus. Yes, we all know to say we have individuals with diabetic, they usually develop what we call a diabetic foot. So that could indicate what? Amputation. Yes. So those are some of the indications of amputation. There are quite a number of them, but those are some of the indications. Yes. Then when we talk about the pre-operative nursing management, the main important thing when we talk about the pre-op is knowing as to whether it is an emergency or what, or elective. Yes. So any condition to do with, I would say, any trauma that brings about severe bleeding, just not to say that would require what? An emergency amputation. Yes. Conditions such as cancer, osteomyelitis, all these are what? Elective conditions. Yes. Then, when it comes to pre-operative nursing management, the specific thing there to mention is what? Is pain management, and also what's this? Wound care, or simply care of the what? Of the stump. Instead of mentioning wound care, you can specify by mentioning to say care of the what? Of the stump. That one, it is a specific in what? In post-operative nursing management of a patient who is coming from what? Amputation. Yes. Then for the complications, I've always mentioned to say the complications of surgery in almost 80% of all the conditions, they are what? They are similar. Yes. So we can talk about infections, hemorrhage, anemia, wound gapping, hypovolemic shock. All these are complications that would come in as a result of what? Amputation. Yes, but don't forget to talk about phantom pain, because phantom pain, it is a major complication of what? Amputation. Yes, it is a common complication of amputation. So when we talk about phantom pain, what we mean here is a person feels as if that amputated limb, it is still there. Yes, there is that sensation. So that's what we call phantom pain. Yes. So it was just a brief presentation. I hope we've learned something from this presentation. Have a blessed night.